Hi, a very good evening. So today we'll have this interactive video. As I said, I'll be posting this video rather than having a live session. So the objective here is to have active interaction right beneath this video in the form of comments. So what I'll do is I'll give you some set of questions. Also you can find the same on the screen. You can refer and get back with key and explanations or with your own version of your answer, justifying why you think that particular option is the right answer. So these are the following questions which I would like to post, right? So you can consider this as a form of assignment, right? So the first question, as you can see on the screen, the amount of gingiva that is exposed during healthy smile and in gummy smile. And you have the following options: 1 mm, 0.5 mm, 2 mm and 3 mm. So among these, which one do you think is the right answer? And also justify your answer so that we can have some kind of discussion or interaction, right in the comment section beneath this video. And second question, which type of alloy is recommended for complex amalgam restorations? Option A, high copper alloy. Option B, low copper alloy. Option C, slow set amalgam. Option D, quick set amalgam. So give me the right answer or the most appropriate answer, and also why do you think that's the right answer for this particular question, because rather than just key, understanding why that's the right answer is far more important. Okay, now moving on to the next one, the third question. During class 3 preparation for amalgam restoration, gingival retention groove is prepared using which of the following burrs? 245 burr, tapered Fisher burr, 1/4 round burr, or a hand instrument like GMT. Now moving on to the penultimate question, the fourth one, post-operative sensitivity. Once you have done aesthetic restoration, it can be GIC or composite. Post-operative sensitivity can be due to option A, high C factor. Option B, aggressive finishing of restorations. Option C, aggressive tooth preparation. Option D, both B and C. And then we have your final question. No prep veneers. I'm repeating, no prep veneers are indicated in option A, inherently under-contoured teeth. Option B, presence of interdental spaces. Option C, open incisal embrasures. Option D, none. So you have the following set of questions, like memory-based and also clinically oriented questions. Get back with key and justify why you think that particular option or your option is the most appropriate answer for each of these questions, right? So you can post the answers as well as explanations right beneath this video. Unlike other videos where I say get back to me, you can post your answers, your justifications, your explanations right beneath this video. Also, I'll be interacting with you here itself, and we'll try to learn as much as we can from this interactive video, right? So wish you all the best. Love you all.